Hop, bienvenue. Est-ce que tu veux
Do you
faire
want
un
to draw? Ah, play
dessin?
with
Tu veux
toys.
jouer? Bah, tu
Sure,
peux.
go ahead,
Vas-y,
darling.
fais-le.
Elise is 5 years old. She was born with a cleft lip and palate. She had her first surgery at 6 months and another on her second birthday. In a few weeks, she'll undergo yet another procedure. She's here to see her speech therapist.
Is it okay if I put this under your nose like last time? You're going to say pa-pa-pa.
Papa,
Well done.
Oh,
Pataka.
patata,
Badaka.
padaga.
Since she was born, Elise has been in the care of doctors at Nantes University Hospital. Last year, the clinic launched a unique program for children whose parents were exposed to pesticides at work. Elise is one of the first patients.
I work as a baker. I use non-organic flour, and my partner works at a timber mill, so it could be due to pesticides.
A geneticist and a surgeon are behind this novel initiative. In 2025, they discovered that a number of childhood medical conditions are scientifically linked to pesticide exposure. They now routinely ask parents what they do for a living.
We handle wooden panels, which have been recycled and treated. But we don't know what they've been treated with. Some of the products we use are toxic, but what can you do? We don't have a choice, really.
All good? We've checked the eyes already. She's going well. Nothing to report? Wonderful.
Open your mouth, please. Show me your teeth. Well done.
Pierre Corr has been the family's primary doctor since the prenatal diagnosis. He'll perform her third surgery.
The goal is to close the gap in the gum, which creates a connection between the mouth and the nose. That's not normal. So it needs to be closed. To do this, we'll take a small amount of bone from the hip.
Once the surgery is scheduled, the family is referred to the Occupational Health Service.
Bonjour, Elise.
The department helps patients who want to file a request for compensation. In 2020, the French government created a special fund for victims of pesticides. Nantes is the country's second hospital to have a dedicated unit.
In my report, I do point out the fact that you were exposed to wood dust on a daily basis, and we know that wood can be treated with insecticides. I do believe that you meet the criteria.
A panel of experts will review the case, deciding if the girl's condition can be linked to her parents' pesticide exposure. In addition to birth defects, the fund also covers cognitive disorders and cancer.
Whether it's children or adults, when it comes to occupational diseases, we also see lymphomas among farmers. Personally, I've come to the conclusion that we almost have enough evidence to ban pesticides.
By creating a fund, the government effectively recognizes the dangers posed by pesticides, including to fetuses in utero. Yet few people know the fund exists. Laure Marivin is the first victim in France to have received compensation for the death of her daughter.
I'm Emmy Marivin's mother. She died at the age of 11 as a result of pesticides sprayed on the flowers and plants I handled as part of my job. Who could imagine there would be so many different substances and that all those substances would enter my body and poison the daughter I was carrying? You're holding a bouquet with one hand, and just blowing your nose means you're covering your face with chemicals without even realizing it, because to everyone around you, you're not doing anything dangerous.
85% of flowers sold in France come from abroad and have been sprayed with pesticides banned in Europe. The consequences can be devastating.
The first month in hospital is extremely difficult because they prepare the child's body for chemotherapy.
Emmy couldn't walk anymore. Our whole house was turned into a hospital with oxygen tanks for Emmy and machines to monitor her condition.
From the age of 4 until she was 11, Emmy underwent thousands of medical procedures. She achieved full remission, but relapsed 3 times. Emmy remains the only case of a deceased child recognized by the fund.
The government recognized that Emmy died because of pesticide exposure. But they continue to give a free pass to all these products. They're the ones authorizing them on the market. So for me, they're not protecting us.
In its most recent report, France's Public Health Institute concludes that there is a strong link between a mother's exposure to pesticides during pregnancy and the risk of certain cancers. Pediatric cancers are the leading cause of death from disease in children in France. Conducting studies on infants and fetuses is of course forbidden, but researchers in the northern city of Amiens have found an alternative.
Meconium is the baby's first stool, right after birth. It gives us a window into the baby's exposure in utero during the last 3 months of pregnancy.
More than 1,000 mothers donated samples of their baby's first feces. To this day, 85% of them contained traces of at least one pesticide.
That means pesticides can cross the placenta, or pass through the umbilical cord and reach the baby. A baby has no protection in the womb.
This lab is the only one in the world to study how chemicals can interfere with vital functions in infants, from conception to the child's early days.
It's an artificial human intestine. It will mimic the gut bacteria of a baby.
Kept in the dark at 37 degrees Celsius, it was designed to reproduce real-life conditions. It even releases gas, except it's actually a computer that controls it.
We do traditional feeding methods such as bottle feeding or breastfeeding. We try to replicate as closely as possible what all babies eat.
The experiment also reproduces our average diet, which includes foods contaminated with pesticides.
We add a dose of pesticides. Here we have chlorpyrifos. Although it's banned, traces can still be found in fruit, vegetables, and wheat.
The lab studies the so-called cocktail effect. A growing body of evidence suggests that when combined, pesticides turn out to be more toxic than on their own.
We're not focusing on just one pesticide. We're studying a combination of them. We selected the substances most commonly found in our diets, including chlorpyrifos and glyphosate.
Research has shown that ingesting pesticides can alter our microbiome, especially during pregnancy. A phenomenon that has been associated with a higher risk of obesity, diabetes, and cancer.
It can throw an entire ecosystem out of balance, including the good bacteria in our gut. The good bacteria will drop, leaving a vacuum to be filled by harmful bacteria we call potential pathogens.
Although several pesticides have been banned and organic alternatives exist, France remains the #1 consumer of pesticides in Europe. The southwestern region of La Rochelle, heavily exposed to pesticides, has become an epicenter for clusters of childhood cancer. In the town of Lumeau, home to 3,000 people, there have been 5 new cases, compared to a national average of 1.8.
We've carried out tests in the whole area, and when we find herbicides and very high nitrogen levels at a depth of 14 meters, we have to ask ourselves some serious questions.
Frustrated with government inaction, the mayor decided to act.
We bought 20 hectares of land used for intensive agriculture, and we're going to turn them into a meadow and a market garden. Before, these homes were right next to a farm, and we want to protect them from all the chemicals that linger in the air when weed killers and fungicides were used here.
He made an offer to neighboring farmers to transition to sustainable farming. They all refused.
I'm not a green mayor, but I'm a mayor who cares about the environment. My goal is to protect everything around us: homes, nearby oyster and mussel farms, a nature reserve, a bog where migratory birds have been spotted. We need to find a way to balance it all so that everyone can work and live in a healthy environment.
The scientific community is sounding the alarm. Victims and citizens are seeking answers, but authorities continue to ignore the warnings. Meanwhile, more children are born sick, with lives shattered before they've even begun.